Have you ever wondered, how does a disc injury in your back affect the nerves in your body? Have you ever felt like shooting pain going from that lower back all the way down your leg? Burning sensations, maybe even it tingles a little bit. Our body could even have a numbness in our feet. A lot of people are going to call this sciatica, but what is actually happening inside of your body? We're going to talk about that today. I'm Dr. Garst with the Well team in Mesa and Gilbert, and I'm going to show you today how a disc injury can irritate those nerves and create what we call sciatic pain. And more importantly, why the pain isn't always where the real problem starts. So let's start by explaining what sciatica is. Sciatica isn't a diagnosis by itself. It's actually a symptom that's caused by an irritation or compression of the sciatic nerve. That's the longest nerve in your body. It's about the size of a thumb. And it starts here in your lower back and it travels down through your hips and glutes and it can run down each of your legs. So when something irritates that nerve, primarily near the spine, it can radiate far away from where that actual injury is occurring or where it has occurred. That's why someone with a disc problem in the low back might feel like pain in their butt. They might feel leg pain. They might, like we talked about a second ago, numbness, tingling, burning, weakness in the foot or leg are very common when that nerve gets compressed. So let's talk about another thing. How are discs designed? How do they work? Now, between each bone of our spine sits a disc. Think of these like little shock absorbers. Each disc has like a tough outer layer and a soft inner gel-like center. So the job of these discs is to absorb pressure and help your spine move properly. But over time, after injury, wear and tear, degeneration, these discs can become damaged. Now, when this outer layer weakens enough, this inner material can start pushing outwards. This is what a lot of people commonly call a disc bulge, kind of like this, or a disc herniation, or even a slip disc. And that's where the nerve problem begins because it's going to put pressure on that. So let's talk about how that nerve gets irritated, okay? I'll bring this guy back in. Our spinal nerves exit through these small openings between the vertebrae called foramen. Now, when a disc bulges backwards, here's an example, it can crowd that space and it can irritate the nearby nerve root and sometimes compressing that nerve mechanically. Inflammation can be a huge factor in this too, because when we have an injury, when we've had some wear and tear, when we've had some degeneration, the body's going to release some chemicals around that irritated disc and press on that nerve, causing even more compression. So that nerve path then irritated is going to send that signal all the way down the path of the sciatic nerve, which can mean you feel that leg pain, but it could actually be coming from, again, your back. So sometimes sciatic symptoms look different from person to person. Sometimes people feel the sharp pain in the back. Sometimes they feel the shooting pain, the pins and needles. They can experience muscle weakness or pain that gets worse as we sit for prolonged periods of time. A common pattern is pain traveling down just one side of the body, usually not both. But in more severe cases, people will notice weakness in that foot or leg. That's the motor part of that nerve actually being shut down. So that's why getting evaluated if you feel like you have a disc, specifically a bulge or a herniation, really, really matters. So let's talk about a couple things that'll make these injuries worse. Movements can be huge in this, and specific habits that we have or movement patterns that we have can put more pressure on that disc. Things like we've all been guilty of: prolonged sitting, poor lifting mechanics, repetitive bending, lack of flexibility, movement, maybe weak core stability, misalignments from the spine specifically. But for many people, sitting is kind of the big one that's going to increase that sciatic symptom because it's going to raise the pressure inside that disc, put more pressure on the nerve. That's why a lot of times one of the common things we hear is, I feel better when I'm moving, but I feel worse when I'm sitting in the car, when I'm sitting at work, etc. So here's some tips on how chiropractic can help. Treatment really depends on the cause and severity of the problem, if it's a bulge versus a herniation, etc. But with our care specifically, the goal is to remove the pressure on these nerves, your nervous system in general, so that we can get that nerve working at 100% capacity. Think of it like a water hose getting shut off. We can do this by improving spinal mechanics, improving joint mobility, improving motor function, giving you some stretches, but mainly we're trying to calm the area around the nerve. So the main ones that we use in our office are chiropractic adjustments, the number one. We do some mobility work, some soft tissue therapy, maybe some rehabilitation exercises. We can work on some postural correction and then habit retraining from things outside the office, just to name a few of those. But the important thing is that we're going to identify why is that nerve being irritated in the first place, Why is it giving you those symptoms from other areas? So sciatica, guys, can be extremely frustrating, but understanding the cause of that nerve irritation is the first step towards building an appropriate recovery solution. So if you found this video helpful, make sure to subscribe, leave a comment below if you have any questions or want to ask things of us specifically. But more importantly, if you know somebody struggling with sciatica and they've never really found why that is happening or what's going on inside their back that could be causing that sciatic problem, feel free to send them that video or give them our information. We'd love to help them understand maybe what's going on and break that pain pattern for them. Thank you guys for watching. We'll see you guys on another video.